There you go. All right.
Yeah.
So, okay. So Lord, Savannah is on. Savannah works with me at EMI on the doing the MCC, the multiple chronic condition work project, and she's gonna take notes for us. So thank you, Savannah, for doing that. As some of you
Awesome.
know,
Thank
I
you,
recently
Savannah.
moved over. I recently
No
over
problem.
to EMI, and one of the projects I'm working on is the multiple chronic condition project, and this is the same project that I believe was it Cognizant that had that project a little while ago, and now EMI has it, and Kay Dolan, myself, um, Dave Carlson, we're all working on it. We're and hopefully in the future. And that's why I kind of wanted us to postpone a little bit, but I couldn't get anybody to switch with me. So we can give you like a full overview of all the pieces, the other parts that we're doing in this project. We're building an app, a provider app, a patient app, and a caregiver app that deals with chronic conditions, or care is a care planning app. So what is chronic condition? We hopefully will make it general enough that what is chronic condition or just health management, that this app will be able to handle both. And at least that's the goal for right now. But
So
as you
Emma,
know,
uh, Emma, a quick clarification. The scope of the previous MCC project is restricted to about 4 clinical domains, if I recollect correctly. So it's about diabetes, cardiovascular, chronic kidney disease, and also pain management. So has the scope changed?
yeah, the scope has changed some. We're also including COVID long-termers or COVID long haulers in there as well. And I think, like I said, we will probably come back to this group with the full scope of all the pieces that we're going to tackle with this project. I think there's hypertension in there as well. There's some other domains that condition type domains that we're going to be with this project. So hopefully we will have like much more details to provide in the near future, as well as some of the work we're planning on doing with the app, and integrating it, or with like clinical quality guidelines and other patient care projects that we've seen. I mean, that we have all been working on, overseeing or working on or being part of over the years. Hopefully, we can use this project to pull a lot of these things together. We also looking into using the CQL, the clinical query language, as part of this project as well. And this is work that Dave Carlson has done with the VA and with HRQ and at other places. So we're hoping that we're, able to pull all of this together. Um, and Becky, that includes some of the nutritional work that you guys have been working on.
I missed the first few minutes.
All right.
So what what am I missing?
Well, it's just that EMI is now, I recently transitioned from all scripts to
Yes.
EMI, and one of the projects, yeah, so EMI got the contract to work on the MCC care planning, the app, the profiling, the domain, the work that I believe Cognizant was doing. So we're Gabe, myself, Dave Carlson, we're on that project with EMI right now. So it's a multi-year
Awesome.
project.
Okay.
So
And
we're
I
hoping to
see you
keep
guys are doing the January Connectathon. Is that true?
yes,
Because I was going to sign up and participate. I don't.
yeah. And that's why I wanted us to have this call, because I wanted to let everybody know that we are planning on participating. Can you guys see my screen okay? On having a Connectathon track. You guys can see my screen, right?
Yep.
Okay.
Yeah.
All right. I know. Yeah, I'm sorry. I'm new to Mac, and I'm always feeling like I'm not. Something's missing, or something's gone wrong. So yeah. So that's why I keep asking. Can you still see my screen? But yeah. So we are going to be part of the Connectathon track. I mean, Fire Connectathon in January, and I'm hoping that that some of this work will also feed into, or some of the clinician or fire work will feed, will help us align or, make some of this work come into reality. One of the focus on the Connectathon track is we're gonna focus on goals, because we want to really do a deep dive into goals. And I know Jay, and Laura, and Stephen, and Becky, this is some of the stuff that we've been talking about with the care plan domain analysis model. So I don't know why this is taking so
Emma,
long.
now I see a blank screen.
Okay, yeah, now
Okay.
it's
It was
loading.
loading.
Okay,
Yeah.
all right.
Loading. Yeah.
I have a
So,
JIRA ticket I need to add too for goals because I discussed it with the nutrition group.
Okay. Yeah, tomorrow is our Thursday call, so that would be a good time if maybe we can get Michelle to triage it too.
Oh, I haven't
We're
added
ready
it
to
yet. I
fire.
still need to do it. It's on my
Yeah.
list.
Yeah. So the care planning track, we've already did the initial track proposal, and it's up here. We're hoping to integrate it with different endpoints that are already stood up. You guys, I'll put a link to it in chat so people can go through and read, or see what and we will be very open and very happy to any feedback we can get. And now I just need to figure out how to get to chat. Oh yeah, there you go. Wow. And I'll just go ahead and paste the link in here. Okay. All right. So that's a link to the track. And like I say, Dave Carlson is one of myself, the track leads, and Gay Dolan is also participating in this. Savannah's on the call with us. Karen is our project manager. We're at EMI. And so this is ongoing work that we're going to be working on. We're hoping to have some related tracks. And Becky, I don't know if you guys, nutrition have any track proposals or anything, this is something that we can also integrate with or try to work, relate to, could have some collaboration with.
Things we don't have any.
SUAH work. Okay. The SUAH work, Splash, Passio Splash, speech language feeding, those kinds of, and also the subscription tracks right now we're trying, we have listed as related track to support this work. Any questions?
For nutrition, it's not really a question, it's more of a comment. I don't know if we would ever have a specific nutrition track because we tend to try to piggyback off of what other projects are doing and make sure nutrition's incorporated. So just if you see that, keep me in the loop because we're happy to always provide our feedback.
So yeah, care planning, most definitely. I'm sure nutrition is in there.
Splash, it's in there.
Yeah.
So
exactly.
Emma, can Lord here just
Ken.
in terms of and representing ACF, okay, and Dave. So Dave said he would add ACF to expected participants here, and he reached out to me to see if we could take what Oregon had as a CCDA document that was produced from EPIC and have it consumed by the fire endpoint that you're standing up as part of it, and because it has got goals and other kinds of entries in that, and so ACF is we haven't made a decision, but we're very interested in doing that work of taking some sort of outside from an outside organization and having that consumed in the endpoint that AHRQ is setting up. So
Okay.
just as an FYI. Okay.
Right. I'm glad you brought that up. Yes, and I will definitely make sure to let And Savannah is taking notes to let Dave know. He can go ahead
Well,
and update
Dave
us.
and I have talked, and he wanted me to attend this to
Okay.
make sure that you were aware of that this is something that that ACF would be very interested in.
So
Okay.
when you, can I ask a clarification question? So when you said that a CCDA care plan document can be consumed by a fire endpoint, do you mean that it is being consumed as a viewing sort of functionality? So therefore you can view the CCDA document, or you talking about the CCDA care plan document being transformed into a fire resources instances, and so therefore it can then be computationally consumed and manipulated or operated on if necessary.
Yes, the latter.
Okay, all right. So then, and do you have a set of transform structural transform algorithms that has already been defined?
Yes, and we're working on the CDA to fire working group on that work.
Right.
So-
Is that a proprietary, or is that sort of would
No,
be
no,
publicly available?
it's all open.
Okay.
So Stevie, just to give you a heads up, I know you and I had touched base a little earlier last week.
Yep.
About some of the CCDA to fire transformation stuff, and I told you about that project that Jay and I have been participating in, the HL7 project.
Yep.
That meets on the Monday morning, Jay, or Tuesday morning. Ken is also one of the leads on that project, along with Lisa. All of the CCDA to fire transformation thing work.
Yeah, I'm not a lead, but I do
Okay,
participate.
but Ken is a very participatory person on that project, actively participating on that project. So,
Yes.
so just to get, let you know that work, Stephen, that work has been going on as well. And this would be a good test of that, because not everybody, we still have CCD, people are using CCDAs. So, we don't want to
wonderful.
miss half of the, yeah.
I will follow up with you, Emma, because as I have communicated to you in my email, we are very interested in the structural map and the algorithmically implementable transform. So it'll be great to have the ability to access those information pieces. But I will touch base with you outside this call. Thank you.
All right. Okay. Yes. Thanks, Ken, for letting us know. Dave is aware, so we probably may need to do some updates to our track to make sure that information is included in the track.
One other thing is just, and again, no firm commitment on this, but Dave would, from a coordination standpoint, maybe try to set up some meetings within just what this Connect-a-thon track is in preparation. So I think he's going to be reaching out to you on that, Emma, as well. Okay. So if you guys can, I think that would, yeah.
Can you come to the Tuesday call?
You mean the coordination on fire call?
Yeah. Is that possible?
So who's you? Is you Emma?
So patient care. Yeah, so Stephen's patient care work group. We have a project which is we call Clinician on Fire, and the goal of this project is to make the goal of that particular project, because patient care owns a lot of the clinical resources.
No, absolutely.
Yeah.
So I think from our group's perspective, and I'm going to leave this up to Jay. Jay has been participating in bringing a lot of this stuff back to your group, and if Jay, would I be helpful if I attend, or would I be confusing people? Because I can have that capability. I think Jay's on this call. I thought I saw his.
Jay's on this call, but he's multitasking. So can you repeat the question?
So the question is, Jay, Doc, and I'm going to guess here, Dr. Chen, is that, do I have the right name?
It's Dr. Chu, Stephen.
Oh, Chu, I apologize. Asked if we could participate in some of this work that we're doing on the CDA fire mapping and some of the stuff that I just talked about. And I felt that if you've been really sort of the designee on that from our work group, and if you'd like, if I can add value to that, I would, but I think
So
you've got that handled.
we're talking about bringing some of that discussion to the Connectathon?
No, to the clinician on fire call, Jay. So Stephen was asking if you know, some of the work that's being done with the CCDA to fire mapping, if we can sort of enlighten people or let people know about, you know, what we're doing, some of the stuff that we've been doing on that in that group, and if we could do it on one of our Tuesdays.
Absolutely, yeah. Especially if, you know, we might get feedback.
Yeah, no, so
that'd be great.
So if it's an introductory call, I'd love to, if you want me to help with that, Jay, I can, but I'll leave it up to you as to how.
Okay, my apology for sidetracking. Is my passion about anything to do with care plan and also to do with fire that sort of gets into the way. So the reason why I mentioned about clinician on fire is about the 5 pieces that we are very interested in, and also are mindful about the availability of time slots on the Wednesday call. So anything that Jay sort of think would be workable would be fine by me. The only objective that I have is to learn more about the work that you guys have been doing, and I think that those work that you have been doing are worth sharing with the broader community within patient care.
I agree.
Yeah. So Jay, I think what may be helpful is some of the work, the discussions that have been going on around authorship, you know, those kinds of roles and things like that, and how it interplays with workflow. That might be something that would be I think could be of interest, or that patient care can contribute to.
So we're having a fairly well-attended call. Is it the 19th? It's not this Thursday, it's next Thursday, I think, to work that out on our Thursday call. Do you think we want to
5 p.m. call?
Right.
Okay.
So I don't know if it makes sense to. So
I think that would be great.
Question would be, which clinicians on fire call are we talking about? Are we talking about immediately or in January or all of them? Or?
We hadn't really, because we have to look at the agenda and the list of things that we already have scoped up. But Stephen, I think the Thursday call would probably be a good place too.
Yeah, it would be. Yeah.
And a lot of folks on this call on that call as well.
Sure. Yeah. I mean, I don't mean to be fixated on the Tuesday clinician on fire call, but any time that sort of you guys are available to have a conversation, that would be wonderful.
Well, maybe we'll do is next Monday we'll talk with the gang about, you know, what other venues we may want to have for, you know, socializing and getting feedback, and that would certainly be one of them.
Yeah. All right. Well, thanks again for bringing our attention to that, to the mapping work and some of the work that's going on there. So from a care planning or MCC call, we really just wanted to make this group aware of the track that we're going to be doing at Connectathon in January, and also the, you know, because of our participation in Clinician on Fire, I really like. I think it's for us to tie these tracks with some of the work that we do on Clinician on Fire. So anything that we can add or bring, that will make the care planning work succeed would be extremely appreciated.
Yeah, I think that would be good too, Emma. And one of the reasons why I mentioned Tuesday, the clinician on fire call, is that sometimes we get some clinicians piped up sort of without any advance notice. So clinicians like Bruce, he's a cardiologist, and if he pipes up, then it'll be useful to get him to provide his input as well. So that's another reason why I mentioned Tuesday call, but I'm not fixated on that.
Okay. Yeah, it's the same group of people, so we can we usually have multiple pieces of the conversations on depending on who's there and what the context is. All right. So Savannah, did you have anything to add, or am I missing anything that we wanted to bring up other than the Connectathon?
I don't think so. No, I don't. I think the Connectathon was probably the biggest thing that we just wanted to share. Invite everybody.
Emma, I do
Okay.
have a question. So can you scroll down a little bit to display the diagram a bit more? No. Yes, yeah. So in the project, the MCC project that Gay Dolan and then later on Joe were working on, the project focused on the 4 structural components of the care plan. One is the health concern, then the goal, and the interventions, and also the outcome. The work that you guys are continuing on, are you still focusing on those 4 cornerstone building blocks of care plan structure, or are you expanding it to cover other areas that we might have been sort of interested in?
Yeah, so we are still focused on that, on the building blocks.
Okay.
Where am I? So yeah, the design considerations. So and I was trying to IG cornerstones. I believe this is it. Yeah. Yes. So this is actually the IG itself, or at least the current state of the IG as we got it from Cognizant, and I'll put this in chat so people can have a link to it. And Cognizant, they've shared this with patient care time and time again, so we all should have a link to this. Remember, they were using the Lantana tool. Yeah, so we are still focusing on the building, of care planning, and I think this is some of the work of all the moving parts when it comes to activities and the care coordination piece and all of that. And I think the part that we pulled out, because at the Connectathon, we were focusing a lot around goal and what goal does and how goal ties to other things, was why Gabe pulled this particular image to the Connectathon page. But
Right.
the care planning stuff itself is still robust to have all the necessary pieces that we need in order for us to be able to do complete care planning.
Right. So are you then considering other constructs or concepts like risk and also barriers to care? So how are they handled? Are they still, do you consider that that's still capable, the 4 cornerstone building block of care plan still capable of handling those constructs?
And we haven't gotten to the meat of the project yet, Stephen. This is why we're bringing this to patient care.
Right.
Because we want it to be still considered. I mean, you cannot care for our understanding risk and barriers to care, and that's part of some of the, integration with some of the social determinants of health work, all of those kinds of things is, all part of doing complete care for a patient, for a person.
Right.
So
Right.
yes, definitely we want to make this really robust and not leave anything out.
Okay, sounds good. And then the rest will be left to sort of vocabularies or terminologies, that are domain specific, including things like chronic kidney diseases, cardiovascular diseases, and things like that, isn't it?
Yeah.
Okay.
So one of the
All right.
parts of this project also is by identifying value sets that are domain specifics, to be able to tell the clinical story or to provide context of, the clinical story and why patients need the care that they need and that kind of thing. So that's all
Right.
part of this work as well.
Okay. Sounds good.
Yeah. The part that really has me excited about this is, the app development part. Because I can't leave my development behind, Yeah, so I'm really, and trying to look at apps from the perspective of different users, that kind of thing, like the patient, the caregiver, and the provider. Yeah, so I think it's really interesting work because as we are all patients and care for family members and things like that, as well as some of us have been clinicians or providing care for people, pharmacists or dietitians and things like nutritionists and things like that. So I think that really makes me really interested in it because I think everybody have a personal story to tell. You can, it's one of those things where you can really sit and look at it and think, how does it apply to your real life? That always makes me, interested in things, when I can bring it home to myself or to my situation, that kind of thing. That's why I get so
absolutely.
and I start texting Laura, are you listening to this? In the middle of a meeting. But this is really exciting. So I'm very excited to get this work moving and to get all of us to participate and provide input and collaborate. But
Looks
from
pretty good.
the MCC, thank you. From the MCC side, that's all we had for today. And we, you can always reach out to ask us questions. Gary, myself, Dave, Savannah, the whole team, if anything comes up, and hopefully we can all participate in the Connectathon. Don't forget to sign up.
Sounds good.
Deadline
right.
is
Yeah,
this
thanks, Emma.
Saturday for early bird.
Yeah.
Wow, that's right
Hang
away.
on. Are you talking about the January Connectathon? This okay. Yeah, it's December already. Oh, I thought that we are still in November. Okay, now that makes sense because we are already in December. So the Connectathon is happening in January. Yep.
Yeah. All right.
Thanks for the
Now,
reminders on those dates.
yeah. I will go ahead and stop recording. I hope that's okay.